Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, hope you are fine and protected. Today I will start infectious diseases. Among them, malaria is most common, especially in our area. Malaria has ruined and destroyed various nations and generations from this world, and therefore it is a very important historical background. Now I will discuss the definition and types of malaria parasites. Malarial infection is the infection of liver and RBCs. It is caused by a protozoan parasite of genus Plasmodium. Malaria is mostly caused by the 5 species, but in our area 4 are more important. Plasmodium falciparum, it is the most common and dangerous. Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi. Dear students, what do you think are the risk factors of malaria? Now I will tell you important risk factors for development of malaria. Living or traveling in a region where malaria is present. Traveling to the area where malaria is common without taking preventive medication. Being outdoors, especially in the rural areas. The next risk factor is not taking steps to protect yourself from the mosquito bites. And again, different populations, among them the pregnant women and the children under 5 years of age, patients suffering with HIV. This is very important slide regarding life cycle of malaria. When an infected mosquito bites, it injects sporozoites in the blood. And the second important route from where we can get malaria is injection or use of the infected or contaminated needle or transfusion of the blood. When these sporozoites by mosquito bites enters our blood, from the blood they are taken to the liver. These sporozoites migrate to the liver and they form merozoites. These merozoites are released from the liver and they again infect the red blood cells, and the infected red blood cells become the trophozoites. These trophozoites multiply in the RBCs and then converted into the merozoites. In the RBCs, when the multiplication of the merozoites has taken and they become trophozoites, they are released in circulation again. The RBCs burst and it is the main cause of the development of the symptoms in malarial patients, that is the shaking, chills and high grade fever. When these RBCs burst and release merozoites, symptoms of malaria develop. Then some merozoites become gametocytes, and these gametocytes circulate in our blood and they are injected into the female mosquito whenever it bites the infected person. These female mosquitoes pick up the gametocytes for infected humans, and the sexual cycle occurs in the mosquitoes where sporozoites are formed, and the sexual cycles in the females is responsible for the production of the sporozoites, and these cycles continued. Now I will discuss pathophysiology of malaria. As I discussed in the life cycle of the malarial parasite, showers of new merozoites are released from the RBCs at intervals of approximately 48 hours to the Plasmodium vivax, Plasmodium ovale, and Plasmodium falciparum. But in case of Plasmodium malare, it is 72 hours. The episodic shaking, chills, and fever coincides with this release, and the parasite destroys large number of infected RBCs and thereby causing a hemolytic anemia. Diagnosis of malaria is very important, and it mainly depends upon the medical history, your physical examination, laboratory diagnosis. Laboratory diagnosis involves microscopy, and it is the most important test we do in our common practice. We make thick and thin films for the malarial parasites. Then important test is the quantitative tuberculosis, but it is not routinely done. The most important tests we do and order in routine are the thick and thin smears to see the malarial parasites. Then immunological techniques are also there to help in the diagnosis of malaria. These are antibody based and antigen based. The antibody based techniques are serological tests, includes indirect fluorescent antibody test, and ELISA, that is the enzyme linked immunosorbent assay. The antigen based techniques are rapid diagnostic tests for the diagnosis of malaria. Then there are molecular techniques which includes PCR. that is the polymerase chain reaction for the diagnosis of malaria. Treatment of malaria is also very important. To treat malaria, we mostly understand two concepts. The geographic pattern of susceptibility of the Plasmodium falciparum to the anti-malarial drug. Because the drug resistance is very common against anti-malarial drugs, and the type of Plasmodium species causing the infection. For Plasmodium falciparum, it is in chloroquine sensitive areas we prescribe chloroquine. It is a very cheap drug and available. And in chloroquine resistant areas, we also give quinine, mefloquine, sulfadoxine, pyrimethamine combinations, and also use Chinese salts available by the trade name of Artem. Regarding Plasmodium vivax, malare and ovate malarial infection, we give chloroquine along with the primexine because in this malaria, vivax and ovate chronic stage is more common. In order to eradicate this chronic cycle of the malaria, we add primexine in these patients. Now regarding complications of the malaria, different species have different complications, and Plasmodium falciparum is known as malignant due to its severe complications. It results in the cerebral malaria, hemolytic anemia, resulting in the black water fever, jaundice, and hypoglycemia episodes. Plasmodium vivax results in chronic malaria, and relapses are due to the liver cyclosides. Plasmodium malaria results in the nephrotic syndrome. These complications are specific to different species types of malaria. Plasmodium ovale relapse due to liver hypnocytes and result in the recurrent episodes of shivering and fever and result in chronic malaria. The complications of the malaria. Central nervous system involvement result in cerebral malaria, and it is manifested by convulsions and coma. The renal complications are very deadly and life-threatening. Hemoglobin urea result in the black water fever, oliguria, and acute renal failure. In complications regarding the hemolysis, it results in disseminated intravascular coagulation and ARDS, and resulting the signs and symptoms of cough, pleural effusion, and respiratory failure. Involvement of the GI and liver result in the diarrhea, jaundice, and sometimes skin is so much enlarged that it can be ruptured. The metabolic complications are hypoglycemia because the liver is diseased and the regulation of the glycemic control is disturbed and results in the hypoglycemia and fits as well. Severe metabolic acidosis. Other complications are due to the shock hypotension and hyperpyrexia. Dear students, now you have learned that malaria is an infection of liver and RBCs. It is caused by different species of Plasmodium, and 4 species are more common in our area. Malaria is one of the most serious health problems in our area, and symptoms: fever, which may be periodic, chills, sweating, hemolytic anemia, and splenomegaly. Diagnosis is by seeing Plasmodium in a peripheral blood smear. Treatment and prophylaxis of malaria depends on the species and the drug sensitivity levels in that area. Dear students, thank you so much for your kind and patient listening. And in higher grades, you will learn more regarding symptoms, treatment, and prevention of malaria. It is enough for this session. Thank you so much.